Contact tracing is a fundamental part of outbreak control. It's used by public health professionals across the world. It's long been a pillar of disease control, but it's been brought, I think, more into the public consciousness over the last few months than perhaps it has been in the past. And the detailed pictures that it can create can act as an essential guide to us as we seek to manage our way through COVID-19 and out of the other side. We know there have been some particular challenges around COVID-19. So how do we make sure that those detailed pictures I talked about are comprehensive in their coverage? COVID-19 has had its severest impact in communities of colour. So how do we make sure that contact tracing reaches those communities? If it doesn't, then there's at least the possibility that inequities will widen rather than narrow. How can we mobilise people from those communities to trace and interact with trust and empathy? And we've seen all sorts of approaches begin to emerge from across the United States and indeed beyond, including in some states the use of the National Guard as contact tracers, which seems somewhat suboptimal from my point of view in terms of how do we create community trust and empathy. Then I think there's a second set of issues about how do we secure the right workforce. So no more than a handful of states are in the right kind of position. So we don't have nearly enough contact tracers, and we're not ramping up quickly enough. And I think there are questions also about, do we have the right skills and the right values in our contact tracing workforce?